Hey, hey, hey. Buenas tardes. Good afternoon. How is everyone doing? I guess I have to start by saying I apologize about the little snafu with the timing. Um, Miss Wendy and I had the time down packed, but I think she was working with the Eastern Standard Time and I'm a Central Standard Time. So when it was 2 o'clock, I'm like, Miss Wendy, it's 2 o'clock. It's not 3 o'clock. So anyway, we fixed it. So thank you so much. So let me start by saying a big, huge, ginormous, Texas-sized, and you know it's summertime, it's in Texas, Texas-sized thank you to Miss Wendy. You know, I'm good. I think I'm pretty good, okay? But Miss Wendy, that chick is good too. As a matter of fact, I'm the queen bee, okay? But I'm gonna let Wendy sit next to me because that chick is doing her thing. So Miss Wendy, more power to you. Hi, sweetie. And so that being said, let's get the party started. So my name is Dr. Lulu, aka the Momatrician. I am a national, now international keynote speaker. Hi, Wendy, on child, teen, and young adult depression and suicide. So I want to say a big thank you to Miss Wendy again for doing this, for having this event. I watched a few of the shows of the talks yesterday. I watched one today, and I was just floored by the quality of people that she's handpicked to do this conference. So let's jump right to it because you don't want to waste too much time so we don't run out of time. I know Miss Wendy said 1 hour. I'm like, 1 hour? Have you ever heard me talk before? But on that note, we're going to get started. So my topic today is help, my child is suicidal. And I just thought that was a great topic to pick in the month of June, following the month of May. Did y'all know, for those of you in Nigeria, did you know that in Nigeria, last month we had a total of 18 reported suicides? 18. So 18 means many, many more. Okay? It means many, many more because as you can imagine, majority of suicides are either not reported at all or they are misclassified as, I'm just going to guess, an overdose or something, or she drowned. Unbeknownst to us, it was really a suicide. So my take on it is if they had 18 reported suicides in Nigeria in the month of May, we had at least 50 or more. Most people just don't want to talk about it. They don't want to report it. And so somebody has to talk about it. In the US of A, as at last week on June 18th, the news flash stated that there has been so far in the US, 18 in May, sweetie, 18 reported in May, last month. But in the US so far, we've had, believe it or not, for children aged between 15 and 24 in the US of A, we've had 1,200 plus females and over 5,000 boys, males, young men have died of suicide this year alone. So if that is not a problem, I don't know what is. I don't know anything that can kill people that many in 6 months and no one is talking about it. I don't know anything. So if you do, please let me know, okay? And when you join, please give me a high five or give me a thumbs up. I love those. So let's get the party started. So why me? Why am I sitting down here in my summer clothes talking to you about suicide? Why? Well, if you must know, I had my very first, hi sweetheart, I had my very first personal contact with suicide in the year 2000. My friend who, we're going to call Ngozi because her real name is Ngozi, believe it or not. Ngozi and I worked at Eco Hospital together. If you live in Lagos, you know Eco Hospital is well, it used to be at least on Mobolaji Bank, Anthony Way in Ikeja, in Maryland of Lagos. We worked together there. So Ngozi and I came to the US together and I kind of started my practice and did what I was doing. And I was pregnant. I was 7 months pregnant with my second son. On just a nice Sunday afternoon, I picked up the phone and I called Ngozi's house to speak to Ngozi. And her 16-year-old niece said to me, oh, Auntie Ngozi blew her brains out a few weeks ago. That is what her 16-year-old niece said to me. Auntie Ngozi blew her brains out a few weeks ago. That put me in instant labor, and my now soon-to-be 19-year-old son came in at 7 months. That is the power of bad news. So I have had a personal experience with someone very close to me dying by suicide. You think I got over that? Not really. But fast forward 2008, I had a patient we're going to call Michael. He came to see me with his mom. His mother was concerned because his behavior had changed. She said he wasn't doing the things he used to like to do. He was the quarterback. For those of you who know American football, the quarterback is like, I don't know, like the skipper, something. But he just didn't want to play football anymore. He was just not acting like himself. And so she brought him in to be seen. And I was like, okay, after talking to him and taking all the history, I realized, I said, wait, this kid is severely depressed. So I spoke to Mom. I said, Mom, he is very depressed. He needs counseling, he needs medication. You know what she said to me? She said, oh, depression? Child, please. I had depression. My mother had depression. We all did okay. Don't worry about it. He's going to be fine. You know what happened? On 4th of July, 2008, in front of his entire family. You all know 4th of July is American Independence Day, so they have barbecue. In front of the family during their barbecue, Michael put a double-barrel shotgun in his mouth and pulled the trigger. Second contact with suicide for me. So at that point, I'm like, maybe it's just a fluke. Maybe it's just going to be the one. Maybe it's not going to happen ever again. But between Michael Knight in 2008 and 2012, when I joined the Air Force, I noticed an increase in number of my patients that were presenting with cutting and depression and suicidal ideation and suicidal thoughts and suicide attempts. Then I joined the Air Force, and then I joined, okay? I got divorced. I sold my beautiful home. I moved across from North Carolina to Texas with 3 boys as a single mother, and life hit me like a bolt out of the blue. And I became severely depressed myself and suicidal. Are you seeing a pattern here? I'm giving you guys, yes, the risk factors for suicide. I became depressed. I became suicidal myself. And so what happened? That I was suicidal because I felt like I was a loss. I felt like I was a failure. I felt like I had disappointed myself, my kids, my family. Because of course with the divorce came bankruptcy. She says, bad network. Oh, I'm so sorry. Is anyone else having bad network? I'm so sorry. But we have great weather here, so I don't know. But I became suicidal myself, and thankfully she stopped what she was doing and took me to the doctor. I got medications, I got on counseling. It took a long time, and I'm better. I'm better because every day is still a struggle for anyone who's been depressed before. It's still a struggle. So that's the little preamble, okay? Believe it or not, in 2018, last year, I had my youngest patient present to me with depression, and he had ADHD. You know what happened? He tried to hang himself not once, but twice, and he was only 8 years old. After that, I was like, I'm done, because I'd had multiple patients who had attempted suicide. I can't even tell you how many. And in my practice, I see 2 to 3 patients every day who are cutting and sad and depressed and suicidal. So what I decided to do was, I'm just going to quit my job. So I quit clinical medicine, and nowadays I do public speaking on child, teen, and young adult depression and suicide. So that's my story. What's yours, right? You can holler at me later, okay? But in the meantime, that being said, I'm going to read out some statistics for y'all, just so you can kind of get the feeling. So in the month of May, we already talked about the month of May in Nigeria, there were reported 18 suicides in Nigeria that were reported now. Like I said earlier, if 18 were reported, the number is probably close to 50 to maybe even 100. We don't know for sure. Now, in the US, every 4 seconds, a teenager attempts suicide. I don't know for how long I've been speaking, But you do the math. Every 4 seconds, a US teen attempts suicide. Every 12 minutes, someone dies by suicide in the US. Every 12 minutes, someone dies by suicide in the US. Every 40 seconds, someone dies by suicide worldwide. I'm going to take a minute here because usually when I give that statistic, I make everyone stop and take a 40-second silence because I believe that it is worth it for us to honor those who we've lost to suicide. Because as you can tell from the stories I've told you so far, it's not a choice that people make easily. It's not a choice that people make without a big reason. So I'm going to ask us to please take 40 seconds of silence beginning now. Thank you. Muchísimas gracias. So that was 40 seconds. And in those 40 seconds, someone has died of suicide. It is so bad that the WHO, believe it or not, has projected, like I said earlier on, that those numbers cannot be accurate because you and I know that many people who have died by suicide, nobody wants to talk about it in the family, nobody wants to talk about it at their job. And so WHO has predicted and projected that by the year 2020, next year, who can guess how many people will die by suicide, how often? 1 every 20 seconds. We're going to have 1 suicide worldwide every 20 seconds. Now, let me ask you a question. If there was a disease process out there that was killing people every 20 seconds, what would you do? Would you not take for the hills? Would you not run away and never come back? I would. But suicide is going to be taking 1 life every 20 seconds if we continue to go at the pace and at the rate and the way that we're going. That's food for thought, okay? Now, that being said, what is suicide? Just in case you didn't know, it is the process of ending one's life purposely, which means you decided, or I decided, or we all decided to kill ourselves knowingly. Last month, in the month of May, in India, someone tagged me on a post. We had 15 students 15 students die by suicide at the same time. It was a planned event. All 15 students took some kind of poison and all of them died at the same time. So there is something called mass suicide as well. Most people don't know about that. But in the olden days, if you're old enough, you remember there was something called Guyana's tragedy. This pastor made everyone in his church drink poison. So suicide is not new. Suicide has different levels. Mass suicide is just as good as individual suicide. Most of us hear about the suicide bombers. So suicide is not new. But the problem is that nobody wants to talk about it. I just gave you different avenues to think of suicide. Now, that being said, there's a phenomenon called suicide contagion. Whether you say potato or potato, contagion or contagion. Now, suicide contagion is a process whereby seeing news clips about suicide, seeing discussions about suicide, being exposed to suicide excessively triggers suicidal behavior in people at risk. So, suicide is not new. Thank you, Hanina. Suicide is not new. Suicide contagion is a process whereby someone who is at risk is exposed excessively to suicide news, suicide stories, suicide happenings, family history of suicide, and they in turn become suicidal. It's called suicide contagion. I mentioned that because a lot of people have been talking about this movie called 13 Reasons Why. Even the CNN carried the news reel that 13 Reasons Why was apparently one of the reasons why teen suicides have gone up in the US of A. While CNN has carried that news, I'm not going to sit here and say it's true or false. I just know that teen suicide has indeed increased. And like we said, 5,000 boys so far, over 5,000 so far this year, and over 1,200 so far this year of girls have died by suicide. Just age 15 to 24. So you go figure, you know? Now, you want to know about Nigeria, for those who are in Nigeria that are watching me. What are the numbers in Nigeria? Well, unfortunately, I can't tell you the accurate numbers because what is the biggest problem in Nigeria? We don't have accountability. We don't have record keeping. So I don't know for sure. However, they have said that Nigeria is number 555 in the continent of Africa. Nigeria ranks 15th in suicide ranking in African continent. You want to know what country is number 1? Lesotho. The Southern African country of Lesotho is number 1 suicide in African continent. Now, worldwide, Nigeria is not doing too badly. We're ranking number 67, which is almost good news, right? If you don't know any better. The problem with Nigerian suicide rates is what? We don't know for sure that those numbers are reflective of the real situation. And that is the problem. We had 18 reported last month. Maybe there were more. Probably there were more. So that's the problem right there. The US is 27th in the world, which is good. Not too bad at all. I really thought US would be higher because there's a lot of suicide going on. But the East European country of Lithuania ranks as number 1 for suicide in the whole world, coming in at 31.9 suicides per 100,000, which is a lot of people. The other problem with Nigeria is one of the few countries where female suicide rates almost approach male suicide rates. I wept when I heard that. I know Senajano they carry last, but I was very, very disappointed in the fact that women in Nigeria are treated, as you all know, less than second-class citizens, less than the pet. There's no child education for girls. There's early marriage. There's polygamy and all kinds of There's sexual abuse of boys as well. Don't get me wrong. But girls. And that is why the average Nigerian female has lost hope, so much so that no other country has 17.1 suicide deaths in male and 17.5 suicide deaths in male per 100,000 and 17.1 suicide deaths in female per 100,000. That number just almost killed me because most countries the world over, except maybe India, which has a high rate of female suicides, for obvious reasons, almost paralleling Nigerians' reasons, women are just not usually treated as badly as it is in Nigeria. And so the average Nigerian woman is not doing so well. And so if you're a sister, please look out for your sisters. It is very, very, very bad. Unfortunately, women are our own selves' worst. There were more that went on. Yes. My husband's plumber told us his neighbor's 7-year-old son who killed himself last month in Abuja. Of course, he never made the news. Thank you. Thank you so much. High five, Adeola. Thank you so much. Exactly. Indeed. And Wendy says not anymore. We're changing it. You know what, Wendy? God bless you. We are changing the narrative. So help me God. I'm coming to Nigeria, as you know, and you're going to be on the panel. We're taking our Sister Know Your Worth movement to Nigeria. Women, we need to know our worth. We need to stand up for ourselves. But that's another day's topic, right? And so, what are the risk factors? I know you guys want to know what are the risk factors. What are the risk factors for suicide? When you look at most of the literature, you will see majority of the suicide reasons are so numerous that you can't really say there's one thing that you can hold on to that is this is the one reason why people die by suicide. I gave you my own story. I gave you Ngozi's story. I gave you Michael's story. I gave you Elijah's story. I gave you so many more stories. As a pediatrician, my biggest concern obviously is not the adults, because I'm a pediatrician. It's the children that are dying. They are the future. And when a 7-year-old or an 8-year-old or a 15-year-old for that matter, or a 19-year-old for that matter, even a 24-year-old, who, as you know, is still a child, if they are killing themselves at this rate, who is going to take care of you and I? Who is going to be there for us? They are our future. Who is going to be there in the future? So Nigerians, Africans, the world over, wake up. Let's start talking about it. I would like the spark, okay? So the risk factors are so numerous, but the WHO has been nice enough to give us this beautiful class. I know you can't see it, but this beautiful classification, which I like personally: individual, sociocultural, and situational. So we're going to take it one by one. Individual reasons or individual factors for suicide. Number one, for the world over, I'm going to use mental disorder because that's what the statistics say. But I'm here to tell you that for children, mental disorder is not the number one reason for suicide. Who wants to guess? The number one reason for suicide in children is family drama, parenting drama. And that's why I love this platform that Wendy has. A child that feels misunderstood, not understood, unloved, invisible. Someone please write these things down for me if you don't mind. Unloved, uncared for, beaten up, killed by parents. I see the news in Nigeria every day and I just weep. We had a guy recently who killed a 6-year-old. I get emotional because I can't talk about it. A 6-year-old boy, he killed his son. And then there was the one guy who tried to kill his 3 sons recently because they said his sons were witches. Because you know what? I don't blame the kids that want to kill themselves. If you're going to live in a family like that, a man that killed his own child because of he stole something, I don't know, whatever. Either way, your child is a reflection of you, by the way, just in case you don't know. So if your child is stealing, what are you doing to show him that? Because you're his first teacher, Mr. Man that wants to kill his child for stealing. Just FYI. But I digress. Second cause, alcohol abuse, drug abuse. Naturally, that's a personal thing because I choose to drink alcohol, I choose to use drugs, so it's personal. I like the fact that it's put there. But in Nigeria specifically, we have hopelessness, academic stressors. Most Nigerians, I know I was guilty, or rather I was a victim as a child. Oh, you must go to med school, you must be a doctor, you must be a lawyer, everybody must be a doctor, you must carry first. So if we're all going to carry first, then who's going to carry second and third? You know, of course your child is a, thank you, Wendy, it's a reflection of you. So if one of us are going to carry first, who's going to carry second, third, and fourth, and 29th? Who's going to carry that? But we put so much pressure on our kids. And if you go back to the stories from last month, you will know that Akachi, that boy that put the thing on the news on Facebook, he was like a straight A student, I think a law student. My belief is that he was stressed to the max, amongst other things, trying to keep his grades so high. And unfortunately in Nigeria, even if you score first class, you come out, there are no jobs. These are real sociocultural problems. So when a child in Nigeria is killing him or herself, or like my son says them, say mom, stop saying him or her, say them. If they're killing themselves, what are we doing to make these kids do this? Okay? Isolation, aka ostracization, which girls do a lot. I'm not going to talk to you anymore. You're not my friend anymore. Little things that don't even make any sense, right? We do that a lot in Nigeria. Not only on the children level, even as adults. We're not going to talk to her anymore. We're not going to play with her anymore. And you know what I call the cyber bullies, which is part of a personal thing for the bully? I call them keyboard gangsters. Somebody please write that down for me, because you can hide behind the keyboard and write anything that comes to your head without sieving it. Why do I say that? I say that because when I looked through Akachi's page after he died, I cried when I saw the vile hatred that came out of people for a boy that was so sad that ended up killing himself. The negative comments, I could not believe it. I did a Facebook Live just on that. The negativity. People can type hiding behind keyboard gangsters. Thank you, Oluwakemi. They hide behind the keyboard and write anything. Write anything. And then tomorrow they are the first in church and they're sitting in front row. Don't forget that. Please, don't let me go there. Other things include trauma or abuse, like we said, child abuse, sexual abuse, molestation. I'm cradle Catholic, but I stand here today and tell you that the things that Catholic priests have done, only God will judge them. And that's who I know because I'm Catholic. But there are many, 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 many more. And the reason that they can get away with it, because the church protects them. In America, when a Catholic priest has molested a child, you know what they do? They post them to a different place. They post them to a different place so somebody else can become victim again. Please. Thank you. Emotional distress, like the death of a loved one, like divorce. In my case, after I filed for divorce, after I got divorced from my ex-husband, the first thing I did was get my kids to therapy. I put them in therapy because I did not want them to believe, which kids usually do, that when their parents get divorced, it's their fault. And so I put my kids in therapy because I wanted to make sure that they do not grow up blaming themselves for the sins of their father and their mother. Okay? Job loss, as you can imagine. In Nigeria is so bad because you don't even have jobs, I'm not saying you cannot find a job, but this is not much. And they don't even throw in the other things like BH and co. I mean, it's just so, it's like there's no hope. And so hopelessness makes the list, And then you wonder why Nigerian youth want to kill themselves. Floods, loss of homes, things like that, chronic illnesses. People that have HIV and AIDS that know that there's no treatment and there's no hope, at least in some countries. It is enough for you to kill yourself because you're not going to live to be the, whoever that you are meant to be. Okay? People who have cancer, at least in America they do. People who are paralyzed, victims of acid burns, hot water burns, things like that. Individual causes. Sociocultural. Stigmatization. Stigmatization of mental illness. Did y'all know that WHO in 2016 declared that not the mental illness per se, but the stigma of mental illness is a global public health phenomenon. Global public health crisis, the stigma of mental health. And if you're a pastor and you're watching me, I blame you. If you're a priest and you're watching me, I blame you. You know why? Because people who quote the Bible will not give us a break from going to see the psychiatrists. They want you to pray and pray and pray. Oh, forget about it. It's not real. Who told you that? Did we not have a pastor that died recently? That killed himself recently? Let me tell you something. I have nothing against you preaching. I want you to please preach to your congregation to go and see a doctor. Preach to your congregation to go and get therapy. They can pray, but I want them to pray for God to send them supportive family members. I would have been dead by now if not for my own family that supported me. Let them pray that their doctor will recognize the diagnosis and treat them. Let them pray that they will go there and come back and not be stigmatized for having mental illness. Something that they did not bring upon themselves. Don't let us go there. Lack of access to healthcare. Nigeria, numero uno. America, numero dos. In America, there are so many people, so many doctors, yet poor access. If you're black, the doctor will not even give you the right medication. Yes, I said it. It's in the history books. It's terrible what's going on in the outside world. In Nigeria, did you know that there are only 250 psychiatrists? with 60 million mental illness patients. I don't say mental cases because that's wrong. Mental illness cases. And left to me, I want to remove the word mental. It's just illness. Because if your arm is hurting, they don't call it arm illness. They call it ache or body ache or whatever. They don't say mental illness to make you even feel worse. So lack of access, stigmatization. Oh, did you hear that she's crazy? Or did you hear that she... You know, when I went public with my mental illness, with my depression, let me call it that, because I did have, and I was suicidal. When I went public after Anthony Bourdain died, that my video has been viewed like 6,000 or more times. When I went public as a black female physician with history of depression and suicidal ideation, another doctor commented and said, don't say it too loud. You don't want the Texas Medical Board to hear about it. You know what I wrote to him? I said, bring it. Bring it on. Let them hear about it. I want them to hear about it because you know why? 400 doctors kill themselves in America every year. And that's for those that are reported. Why are they killing themselves? Because they're all happy? I don't think so. So bring it. If by going public with the fact that I have depression and I've been suicidal and I'm getting help, you think someone else is going to get me in trouble, let me see it happen. Of course it's not. Because finally, somebody wants to talk about that which we all don't want to talk about. And then you want to hush them. Do you know my name? That's what I thought. Other things that can cause that. Cultural and religious beliefs. In some countries, it's actually okay to kill yourself. There are many, many countries where they say it's okay to kill yourself. And so for that reason, suicide is higher in those countries. And then there are some other countries like Nigeria where you get punished. Did you know that in Nigeria, suicide attempt is a crime and you get 10 years? You get 10 years if you attempt suicide and you get caught in Nigeria, because suicide is still a crime. Oh my God. Okay. Wendy, are you sure you don't want part 2 of this? Okay. And then there are other things like, oh yeah, I'm going to mention that later. Situational. Like me, when I said I was divorced, I was single, I was in private practice, I filed bankruptcy, I joined the military, all of those things, I was a single mother. All of those things just kind of piled on me. Sometimes it can just be overwhelming. And so most people that die by suicide, the main reason is they have so much stressors that now overwhelm their personal resiliency. And then they give in, you know? And so that's one of the things that can happen. Okay? And of course, easy access to the weapons. I did a Facebook Live on this. Nigeria, you can just walk up to the next chemist and get sniper. I wonder why people are dying by drinking sniper. Hello? In America, a 13-year-old can go to the store and buy a gun. Did you know that? But they cannot buy cigarettes. Did you know that? You have to be 18. So easy access to the weapons. Be it a swimming pool in your house. If your child is suicidal and there's a pool, even if they can swim, they can make themselves drown. Easy access to other things like drugs. If you keep psychotropic drugs in your house, like opioids, and your child gets it and gets high on it. Hello? Other things like, do you know that the youngest child that died by suicide in America, the two, one is a black girl, one is a white girl, both of them are 6 years old. They both hung themselves with their jump ropes. Can someone please write that down? 2 6-year-old girls, different times of course, both died by suicide because they tied their necks with a jump rope. Majority of my patients who have attempted suicide use the belt. So yes, easy access to the weapons can also increase suicide. I can keep going, but I want you guys to see that. One thing I wanted to mention, special mention here, is family history of suicide is an independent risk factor for suicide risk. We have a lot of causes for suicide. I want you guys to know that, okay? So what are the symptoms of suicidal behavior? What is it that your child is doing that will make you think they're suicidal? The first thing is most of us don't realize that there are even symptoms because a lot of the behaviors mimic normal teenage behavior. Okay? The problem is in America we have such young kids dying by suicide. In Nigeria they tend to be a little bit older, they're college kids, so that's a little bit different. But even at that, many of the people that they report that die by suicide in Nigeria, people just wonder what's going on. They say they don't know, they had no idea, they don't know what's going on. I don't know why they keep telling me that there's network. I have no problem on this end, but I apologize. Okay? So other symptoms include talking about it. If your child who was doing okay suddenly starts asking questions about suicide or the uncle that died by suicide, hint, hint, beware. Be very careful. Okay? Mood swings. Engaging in high-risk behavior. In other words, the child who was doing okay suddenly starts playing Russian roulette. They start maybe, I don't know, using drugs or alcohol, start driving really fast without seatbelts. I'm just throwing all the high-risk things I can think of out there. High-risk behavior. They start giving away their stuff. Their mood changes. They become depressed. They have sleepless nights. They start having thoughts of suicide, like I'm better off dead. If your child ever tells anybody that they're better off dead, please be very careful. They're not joking. Do not think that it's a joke. Do not play it down. Do not underestimate the power of suggestion and suicide contagion like we talked about before. And if you're a parent and you're out there, please, in the name of God, monitor your child's Facebook post, monitor your child's social media. Monitor their social, somebody write that down for me, monitor their social media posts, because a lot of these people, they have left signs, they've been leaving signs on their Facebook posts that things are not okay. And people are reading the post like that Akachi and no one is saying anything. And then suddenly he kills himself. Oh my goodness, what happened? Well, you asked me, I asked you. You are his friend on Facebook. You've been looking at his posts and doing nothing. So please, y'all, please monitor your children's Facebook posts. Okay? And then we already talked about withdrawal from social activities. They don't want to do what everybody is doing. They don't want to hang out with their friends anymore. It's a big problem. Okay? And then cyberbullying. We talked about cyberbullying already. Be very careful. If your child who loves their cell phone. Let me give you an example. Thank God everybody's child has a cell phone now. Everybody has a smartphone. If your child who loves her cell phone, his or her cell phone, or their cell phone, your child who loves their cell phone, all of a sudden, every time they've been on their phone, they suddenly start crying, or they get irritated, or they get irritable, or they slam their phone down, or they stop using their phone. Be very, very careful, because that is one of the high signs that there's cyberbullying going on. Majority of, again, I don't know much about Nigerian children, but American kids, 56% of children in America who die by suicide are not depressed. They've been bullied. Bullying is a whole day, another day's topic. We can talk about that another day. But most of them have been bullied. And now with the advent of tablets and cell phones and all kinds of ways for these people to get to you, a lot of the children are slowly but surely getting bullied through that particular cell phone. So if your child, if you see them drop their cell phone in anger, or they're not on their cell phone and you're wondering what's going on, suspect cyberbullying until further notice, please. Get their phones and look at their phones. You know, it's always funny when people tell me, oh, it's their personal space. Who told you that? Are you the one paying the cell phone bill? Okay, that's what I thought. You better be checking your child's cell phone, baby. I don't want to hear that. Okay? And then, let me see. And of course, talk to your child. Find out what's going on. Are they being bullied? And believe them when they tell you that. Most of us as adults, we forget that once upon a time we were children. Once upon a time we were teens. We forget how much pain it caused when you tell your dad or your mom something and they downplay it. Like, for instance, I'm in love with Eze, and I tell my mom about Eze, if I do. And my mom was like, I don't know what you see in that boy. I think he's ugly or whatever. Whatever it is that you're going to say. Remember that when you were a teenager, that would have hurt so much if your parent told you that. And learn how to communicate with your child. I have an online masterclass that I'm doing about that. Learn how to communicate with your child, your teenager especially. You have 2 seconds to say the wrong thing. And you know what they're going to do? They're going to shut down. And that's it. You can't get to them again. What you should say is, really? I don't really like him, but you know what? Why don't you tell me what you see in him? Humor me. Make me like him. Sell him to me. Make it as a joke. Because if your child, you tell me like, what? Yes, I want to know about him. Tell me all about him. What do you like him? What do you see in him? Make it as a joke so that the child will open up. Your thing is, there's a small door to get into your teenager's life. And once it's shut, it's shut. So if that door opens a little bit, get in and stay in. Keep them talking. There's a post that I had recently that had 50 ways you can ask your teenager a question and they're not going to get upset. A majority of them is, wow, really? Tell me about it. If you say that, that opens the door. What you don't want for your child to do is to shut down. The other thing you want is for your child to think you're cool. You want your child to think you're cool because you're like, wow, really? Tell me about it. Even if you don't want to know. Even if you don't want to know, ask your child to tell you about it. Suppress that tendency to judge. Suppress that tendency to lash out, which we all want to do. That's another thing you want to do. Another thing you want to do is what I call FFFC. Find, fight, and fight for your child. If your child says, Mom, I don't want to live anymore. My life is over. I feel like killing myself. Stop what you're doing and take your child to the doctor. Fight for your child. Stop what you're doing. Show your child that you are their number one advocate. You're the number one, cheerleader. You're the number one supporter. Stop what you're doing. It is worth it in the end. For what is it going to profit you to be that strong black woman and lose your child? Strong black father and lose your child. Or even whatever color father you are or mother and lose your child because you're so busy being proud and trying to judge. Today's world is not last year's world. It's not 20 years ago's world. Children are different now. We have to treat them as if they are different. Thank you, Gold Chinwe. Find and fight for your child. FFFC, absolutely. Okay? And then you want to talk to your kids' friends. You want to talk to your kids' teachers. Your kids' freaking nanny, okay? And if you don't have a nanny cam already in your house, do get one. Please. The stuff that are going on that I see in the news that nannies are doing to kids. I have no problem with a child trying to kill themselves with all the kinds of things that I see that people are doing to these kids. If you don't have a nanny cam, do get one, okay? Remove any objects in your house that can potentially be a source of suicide. One of my Nigerian friends who's a doctor that killed himself last May, he used the kitchen knife, yo. A Delta State guy, he used the kitchen knife and went in front of his wife, stabbed his heart, cut his neck. He did it with the kitchen knife, okay? Nigerian doctor here in the US, in Charlotte, North Carolina. Google him, okay? Of course, you're not going to see that. They're never going to say he died by suicide. They're going to say something else. And then the last thing I'm going to say is, and then we're going to go to questions, is, well, 2 things. Be vigilant. Be vigilant. Know your child like the back of your hands. When your child was a toddler, you will have noticed any little change in your child, wouldn't you? Well, I triple dare you to do the same with your child as a young adult and as a teenager. If they're around, my son is in college at Stanford. I can't see him. But when he comes home, you can bet your bottom dollar my eyes are on him. You know? Talk to your kids. I find that injecting humor is good. Like I said, Chidi. Chidi. What are you doing now? My middle son is Chidi. Chidi. What are you doing on your phone? Let me see that phone. You have a girlfriend? You don't have a girlfriend? Why don't you have a girlfriend? Start them talking. Use humor. They'll be like, no, I don't. Okay, you don't have a girlfriend. So what are you doing on your phone? Let me see. And then they'll show me. But I need you to bring humor. Somebody write it down. Inject humor. Because teenagers will recoil. Once you start doing that, I'm the parent, I'm the father, I'm the mother, they'll recoil. And once they recoil, you're not going to get in. And then the last thing I'm going to say is, and the homework for you guys who are watching me is, make a vision board. Make a vision board with your kids. Make a parenting vision board. What kind of parent do you want to be? Make a vision board and be on the lookout for your child that may be sad, that may be depressed, that may be suicidal. Find out, okay? And please, 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 don't, whatever you do, don't belittle the concerns. Don't say, oh, it's no, well, you guys already know that now. There's so much suicide going on in Nigeria now that you now know for sure that it's impossible for us to say that that child that said they want to kill themselves, they're just joking. Make a parenting vision board, yes. And then you can also make a vision board with your kids. And also engage your kids in your expectations. And let them see maybe what they've done wrong. And let them know that there are consequences. After all, you're still a parent. You're not their buddy. However, your 5-year-old is not your 15-year-old and is not your 25-year-old. You know? Well, how do they say in Igbo? Something, something. Oh, God, I forget that. I think it's Oko Hatoro Cheribe. I think so. When you become an adult, you now wait and then you wait for the other people to become adults. So your little 5-year-old is not your 15-year-old and is not your 25-year-old. You have to engage each one depending on their age. It's not one of those things that you just say, oh, I'm going to still talk to him anyhow. He's an adult now or whatever, you know. But he can still kill himself or herself. So be on the lookout. So that's all I had for you guys today, and girls. Thank you all so much for hanging out to the end. I appreciate it. I don't know if we have any questions. Mostly I see comments. Any questions at all you guys might have, or you ladies might have, or you gents might have, please let me know. Thank you all so much for hanging in there to the end. I know I had an hour, but Wendy said do like 40 minutes and then there'll be questions. So I'm open to questions now. Okay, if you have any questions, ask me anything. Really ask me anything about pediatrics, any questions you might have had in the past. Thanks for your talk, Dr. Lulu. Question: when a preteen shows mood swings, complains of invisibility in school, or is more sensitive than usual, can it be a sign of puberty, or are all those signs to give? Yes, absolutely. That's what I was saying. The first thing I said was most of these symptoms are like they mimic normal teenage behavior or preteen behavior anyway. Many of these things mimic that. And if you go back to when you were a preteen or a teen, you remember that a lot of things that were happening, you just had, yes ma'am, I know, I can see that. I have a big clock here. I know it's 10 minutes to go, I know. Thank you. But yeah, absolutely. Mood swings, invisibility at school, more sensitive. They can totally be puberty. It can be that time of the month, or it can be good old-fashioned depression. So don't assume that just because, you just push everything to, that's what counseling does. That's what therapy does. Just to make sure. For me, I'm about trying at least 6 weeks of therapy just to make sure, see if something is going on. For me, I usually suspect bullying until further notice. I suspect bullying, I suspect ostracization a lot in schools, especially in all-girls schools. I went to an all-girls school, so I know it's awful. There's so much petty friendship and buddy and all those things, and they just kind of sideline your kid. And some people can't handle it. Everyone is different. Everybody's resilience is different. So that's a great question. But yeah, I would take it seriously because, of course, I told you ladies and gents that I've seen a lot of my patients die by suicide. And majority of the time when it happens, everyone is like, we had no idea. We didn't know. But the truth is, 4 out of 5 teens that attempt suicide left a sign. So I would say take it all the way to the max. Take it all the way up and figure out what's going on. Okay? Do you have any more questions? Let me see. Okay, let me read some of the comments then. Oh, you ladies are so awesome. Also, you mentioned nothing about possible mental illness. No, I did. I mentioned that at the beginning, or maybe I don't know when you joined, but I did say in pediatric patients, which is my patient population, majority of my patients do not, that attempt suicide do not have mental illness. 56%, so more than half in the statistics of patients who die by suicide do not have mental illness. Of course, 56% means 44% do, but majority of them don't. And so, yes, absolutely, mental illness can. For me, the main one with suicide is depression, anxiety, and believe it or not, ADHD. ADHD because the compulsive child is a child that's going to try something and then think about it later, right? They're going to do it and then they say, oh, I shouldn't have. They're going to cross the street before looking at both ways or whatever. So ADHD that is untreated, depression that is untreated, even schizophrenia that is untreated. If you have a family history of mental illness, you have a family history of mental illness. So that means it's in your family. My patient that died, the one that I talked about that died by suicide, Michael, he had depression. So I mentioned that at the beginning. And his mother did not believe me that he needed counseling and medication. And then he killed himself. So yes, it does. But majority is cyberbullying, is social media. Everybody is perfect in social media. Nobody is ugly or overweight or poor, or nobody is anything not perfect in social media. And so the world is going towards that line. As a matter of fact, there's a study that showed that in 2011 there was a oh, she said she joined later. Okay, no problem. In 2011 there was a study that showed that when cell phones became like a big thing and we started having personal cell phones, the personal cell phones in 2010, there's a parallel increase of depression and suicidality in teen girls. The study says teen girls. It went this way with personal cell phones. It went that way. Okay, so once we started having personal cell phones, we started having more and more bullying going on, more and more feeling inadequate, feeling like you're not perfect, like your arms are not right, or that your hips are not, or that you have cellulite, or you're not pretty enough, or you're not tall enough, or you're whatever enough because of that. So, yeah. Adeze is just joining. Adeze, hey girl, you joined at the end. All right, everyone. Thank you all so much. I mean, that's all I have. We have 5 more minutes. If you have any other questions about pediatrics, anything at all, just let me know. I'm here for you before Lady Wendy kicks me out. We have Wendy. Thank you so much, by the way. Thank you so much for this opportunity, and thank you so much for your group. Thank you for the things you're doing. I hope to get to meet you in person in Abuja in November when we do our thing. I hope you'll be there. I want you to speak. I want you to talk to those girls. I'm just so thankful. And I'm just so appreciative. Chai, and young people are going crazy on Instagram. That is true. There was a girl on Instagram that actually put a post, believe it or not. She's from North Korea. She asked people if she should kill herself. She gave them a poll, and kill yourself was 52%, and she killed herself. Yes, the world is crazy. This is not the world that you and I grew up. I don't know your ages, but I'm 50. This is not the world that I grew up in. Thank you for all the loves and all the, oh my God, thank you all so much. So I know it's late over there, and I apologize. And next time, Wendy, I promise you I'll do it early. Next year we'll just change it and do it early, okay? And on that note, I'm going to say goodbye. So long, farewell. God bless you. Remember, parenting is hard, but it's the best thing you ever did. So go make me proud, okay? Bye. Toodles. See you in November, she said. Yes, absolutely. Oh, people are still, oh, I look fab, girl. Let me tell you. Yes, I work out. Right? Girl, look at that body. Bye, y'all. Thank you so much for hanging out with me. Oh my goodness. Yeah, I work out. And I eat right. I don't swallow too much. I swallow, but I swallow like, but I just work out and I have good genes. So bye, y'all. I have to thank God for my mother for that. Bye, y'all. I don't want Wendy to kick me out. Peace out.